We're on, I
Yay.
think. Hi, welcome to Fertility Talks. I'm Mary Wong, and I'm the founder of Alive Holistic Health Clinic, one of North America's leading wellness clinics. And I'm the author of Pathways to Pregnancy and your fertility mentor. Tonight, we are super honored to have Dr. Prati Sharma here with us. Uh-oh, we just lost you. Oh, am I there? Am I there? Can
I
you hear
see
me?
you.
Okay, cool. Uh-oh, it says we're having trouble. Hold on a second. Hold on a second, guys. It says we're on, but then it says we're having trouble.
I don't
Seriously?
see that
I just want to make sure we're on.
for sure.
Sorry, guys. Sorry, guys. If you see me, I want to make sure that we're on.
I see on my phone, there's a message saying Alive Holistic
Do you
Health
want to
Clinic
click
is
on it
live
to see if
now.
you see us?
Sure, I can get on to the, I
Because it's
did
on
get a
mine. It
message.
says sorry. It says sorry. We're having trouble
No.
playing this.
I mean, it says live. I see myself.
Okay, cool. All right. Whoops.
And
No,
someone
this is
replied
weird.
saying we can see and hear you.
Okay, cool. All right. So there's something wrong with my thing on my end, but that's okay. So, okay, just as a preface, then, I'm not going to be looking at the Facebook comments at all because we've got a lot to go through. And just so you guys know, because there's this great buzz around this topic. So there are no shortage of questions because between today and yesterday, like I got a gazillion messages come through and asking about the COVID vaccination and, whether you are trying to conceive currently or you are actually pregnant right now or you've just delivered a baby. So there's lots of concerns, lots of confusion and fear. So we want to take some of the myths and hopefully dispel them and, really banking on the research, the most research out there, and then what we see in our practice. So thank you, Dr. Sharma, for being here. And before we begin, we just want to say a little bit about who you are. You've been on our, I didn't even check to see what numbers, but you might have seen Dr. Sharma with us at Fertility Talks before. And so we are so super thrilled to have you back. And in fact, guys, it was Dr. Sharma that reached out and said, hey, we need to talk about COVID and the vaccination. So super, super thrilled. And everyone's totally psyched for this. I think the very first thing is what I see a lot of in the clinic is the let's wait and see is some of the comments that I would get because there's that hesitation. Because here's the thing, you're wanting to conceive and yet there's a lot of unknown. And of course, COVID, as severe as we hear it in the media, when you think about it for yourself and your future unborn child or your, new infant child, there's going to be fear of there's no uncertainty. There is uncertainty. There is, it's a new virus and a new vaccine. So, we can't deny that. So we want to kind of break it and go dig deeper into what we do know right now. So let's talk about that. And actually, sorry, before we really get into this, before I forget, on Friday on Cityline, I'm going to be airing there at 10 a.m. with Tracy Moore, which is the Canadian National TV show, daytime TV show. And the reason I'm going to be on there is because it's a Mother's Day episode, but I'm like, we can't just celebrate mothers. We have to also acknowledge all those people that are trying to conceive that are having trouble. And, Mother's Day might be a trigger for them. So we're talking about that. So that's going to be cool. Next Thursday, Book and Brunch is putting on a supportive community event. So I'm going to be talking at that. And that's with, Susanna Dracul, who is the founder. And so you can check that out. I think it'll be on my Instagram and you can find out more information through that. All right. So now let's get on with it. Thank you, Dr. Sharma, for being here.
Thank you so much for having me on this episode. I think, it's exactly what you said, that the COVID vaccine is really the big buzzword in media, all over our clinics, and really spanning across the board for patients, young and old alike. I mean, obviously our focus is on the reproductive population, preconception, in the conception period, pregnancy, and the postpartum period. And that's certainly what we're focusing on. But it's interesting that it's just expanding now to every population. I'm sure you heard the news today that both Health Canada and the FDA approved the Pfizer vaccine for adolescents. So now everybody's talking about whether it's safe to vaccinate their children. And same thing as what you said, like there's some fear and trepidation about this being new, but yet people are excited that they're going to protect their children. So yes, I mean, I acknowledge all the feelings that women and men alike, to be quite frank, are feeling. But what is it that we do know, and what are the certainties? I think that's where we should start. Mm-hmm. Now we've been almost a year plus into this pandemic. So we've actually learned a great deal about the COVID-19 virus. So in that sense, we're in a good space because we understand the ramifications of this virus. So before we talk about the vaccine, let's talk about COVID-19, just brief overview.
And then actually, before we do that, I need to tell people who you are.
Oh, sorry.
I just said I'm
happy to introduce myself as well.
Yeah, you can introduce yourself. But so one thing is that you are a reproductive endocrinologist and Correct. Specialize in fertility. And you are actually on the board of directors for Canadian Fertility and Andrology Society, where you have the lead on the COVID vaccination guideline, right? You helped actually write.
I'm on the COVID task force, and we have prepared the guidelines together with the SOGC, which is the large governing body for obstetricians and gynecologists in Canada. And we've provided information regarding the vaccine in the infertility early pregnancy population, which is what I specialize in. And I think that's important because of all these questions that are coming from patients. So yes, we've looked at the data quite carefully and really selected our words so that patients feel like they have some evidence-based recommendations coming from people who really know what they're doing when it comes to the fertility world. So yes.
And for the skeptics out there, I just might want to add that you are a mom. Yes. You have care and concern for your own family and your own self well-being, and you have, extended family. So we're all coming at it with our hearts and as well as science hats on too. So it's not, because of course, skeptics out there may believe like, oh, well, there might be some bias and like it's just some kind of I don't know, not controversy. Conspiracy. That's right. Conspiracy theory, right? So we're real people and wanting to make a difference in people's lives. So that's why we're having this conversation today.
Absolutely. So yes, as I was saying, what we learned about the COVID-19 virus is that, the majority of people who get COVID will get mild disease. But now 1 year into this pandemic, there's all these variants, much more resistant strains. People who are vaccinated are even getting more severe disease. And what we've learned particularly about the pregnant population is that pregnant women are at increased risk for more severe disease. That's a fact.
Yes.
And we're seeing that in our third wave in Canada, especially, that pregnant patients are really entering the ICUs. They're needing mechanical ventilation. They're having more adverse events when it comes to the virus itself. And so that's really what pushed Ontario and other provinces to expedite and make sure that pregnant patients are going to be on the front lines for receiving the vaccine. And so in Ontario, we've allowed pregnant women to sort of cut the line and get vaccinated sooner, regardless of their age. And if you look at the literature, what the literature shows is that up to 10% of pregnant women can be hospitalized, which is higher than the normal population. And 2 to 8% will require mechanical ventilation and even more severe therapy, including things like ECMO, premature delivery. They have a higher incidence of preeclampsia. So this is scary stuff. Mm-hmm. And anything that happens to mom affects the baby as well. And in the past, like when the vaccine first came out, exactly what you said, like it was new. We didn't know if pregnant women would be safe. Women are very scared to take anything that could potentially affect their precious baby. But to date now, tens of thousands of women who are pregnant, and not only pregnant, but women who didn't know they were pregnant when they actually received the first dose of vaccine, have received mostly the Pfizer or Moderna mRNA vaccines. And to date, the adverse events that have been reported in the pregnant population after the vaccine are no more than in the non-pregnant population. And this was evidenced by a New England Journal of Medicine paper that was recently published. I have it like sitting here right next to me. The publication date is 2021, April 21st. So literally 2 weeks hot off the press. And this was a study looking at 35,000 pregnant women who were vaccinated between December 2020 and February 2021. And their data showed that the risk of adverse events was no further increased in the pregnant population as compared to non-pregnant women. So, I mean, that's like the most reassuring data we could possibly have in one of the most high impact journals out there, and a large data set. Now, mind you, we all as scientists realize that we don't have long-term data. We don't have data on these kids 5-10 years out. We don't know. But the truth of the matter is these pregnant patients are being protected and they're not having any severe adverse events. They're not filling up the ICUs when they get vaccinated. So I think in that sense, we know that the vaccine appears to be safe in this population. And so that's where we extrapolated to the other ends of the spectrum, which is those who are trying to conceive and those who have just delivered and are postpartum. And so if the vaccine is not causing any adverse events to the developing fetus in the first or second trimester or third trimester, and in fact, we've seen that babies get passive immunity from the antibodies that the mom gets from the vaccine, we know that those women who are trying to get pregnant are not showing increased signs of infertility. They're not showing any adverse outcomes. They can go on to do fertility treatment or conceive naturally and do just fine. There were women who conceived between the first and second dose, same thing, just did fine. And we've seen the data in breastfeeding women and no adverse events for those women. And there is data that the antibodies can also be passed through the breast milk and that your newborn can be protected. So this is really positive data and I think reassuring that all of these populations should really get vaccinated.
So let's break it down. I love that you're saying all this, but of course, people's fears are very specific, right? Sure. So, okay, let's go back. Let's dial it back to then. The first thing that I've there's actually like a lot of Facebook posts right now about menstrual cycle disturbances.
Yes.
Right? So I think the thought pattern is that it's like, oh my gosh, it's ruined my fertility. It's ruined my cycle for life. Right. And sure. there are, so we're not going to deny the fact that in that cycle or maybe two, there can be some delayed ovulation or sometimes anovulation. So not even ovulating in that cycle, but that's temporary. Like if you travel, that happens.
I mean, exactly. And so what you have to remember is you're still putting a medication in your body and you're inciting an inflammatory immune response. And you want that immune response. That's what's actually giving you the protection. And so anything that's inciting an immune response and cytokines and, antibodies could certainly throw off your menstrual cycle for a month. And as you said, something as simple as traveling or stress can do that too. So yes, we find that it's temporary. And actually, this is a topic I can probably speak highly towards because, we have patients coming into the clinic every period to start treatment.
Right.
And they're all women who are getting vaccinated now, especially with the 40+ rule. That's our common population. And I've yet to see a woman come in and say, oh my gosh, I didn't get my period and I wanted to start treatment after the vaccine. So, you're always going to find the N of 1 or 2 or 3, and that's what the media will focus on.
100%.
But it is not something that is rampant. I mean, you talk about Facebook posts, Mary, and I saw a recent post saying, if you are right next to someone who received the COVID-19 vaccine, that your cycle might go off. So, I mean, people take things, it's like pheromones, right?
Yeah.
Things in all different directions. And that's where I think what you're doing is great because it's good at sorting out the evidence-based data from I think this could potentially happen.
Okay, that's a new one for me, but that's an interesting perspective. Okay, so then, with regards to then, so basically what we're saying is that there's no long-term consequence
No, not that
negative
we've seen
consequence
to date. Yes.
right? And then but when you say to date, then people are fearful of, well, that means not right now, but can it affect, like if you're 25 and you're getting vaccinated, who says that it can't affect me when I'm 35, when I'm actually trying to conceive?
You're right. And it's interesting because in New York City, and probably to an extent in other major metropolitan areas, there was a lot of publications about women who are rushing to freeze their eggs when COVID-19 hit, because they thought, what if this virus or the vaccination can ruin my fertility? But there's absolutely no data to suggest that. And I guess where I look back to is those initial frontline workers, the initial healthcare workers who all received the vaccine. And there was, although pregnant women were excluded from the initial trials, lots of women were inadvertently early pregnancy when they got the vaccine, and they've remained pregnant and done absolutely fine. So I think of the pregnancy almost as your eggs. And so if nothing happened to the pregnancy or these pregnancies to date, then we can only extrapolate that there's nothing that will happen to your fertility as well.
Awesome. Okay. So here's the thing. So there's lots of people that are in the camp of, I would like to get the shot, but I don't know when, right? So what is your advice? So for example, let me think of someone. Gosh, I can pull, like, there's so many examples.
I see it every day. Every day patients say, should I wait till the second trimester? Should I wait till the third trimester? Should I complete my fertility treatment before I do it?
Right.
And so,
so start with that.
Yeah. And, this too has really cycled. When the vaccine first came out in our population, we said, maybe hold off until you get your fertility treatment, just in case there's something weird that happens with your cycle. But now, when we've sort of reevaluated the data, we're in the midst of a pandemic. The biggest risk to any of our lives is serious COVID-19. And so with the data that we've seen and the fact that we're seeing younger patients getting infected with the variants, being hospitalized, requiring mechanical ventilation, that is really the topmost, most serious risk. And so what we're telling our patients is, whenever you're eligible for the vaccine, regardless of where you are in your cycle or your pregnancy, please do go get it. Now, the recent data is saying because the Pfizer and Moderna vaccines, the mRNA vaccines, were the most studied in pregnant patients, the recommendation is for pregnant patients, regardless of their trimester, to try to get Pfizer or Moderna, just because that's where the data lies. But if you can't access Pfizer or Moderna, getting one of the other vaccines is better than getting no vaccine. So in the end, this is to say what we're telling patients is the biggest threat is getting COVID-19. Whenever you're eligible for the vaccine, regardless of where you are, breastfeeding, pregnant, any trimester, in the middle of an IVF cycle, go ahead and get your vaccine.
Okay, so that brings that in as well. So some people are saying, okay, but what if I am in the middle of an IVF cycle? Is it going to have a negative consequence when I'm taking extra hormones? Yeah. So you're saying, no, I don't worry about that.
Again, our recommendation is to go ahead. There was a little bit, I will not lie, there was a little bit of hesitancy for reproductive endocrinologists who are giving hormones that can increase estrogen levels and the small risk of clotting that's been described with vaccines like the AstraZeneca. So it's fair to touch upon this because, lots of patients out there, look at the data and hear about it. But, the truth is, and I can support this with the adverse event reporting that is what's happening in Canada as well as the US, the chances of somebody getting a blood clot from the AstraZeneca vaccine is the same as getting struck by lightning. Now, obviously in the media, it's sensationalized, but the truth of the matter is the risk is so low. Mm-hmm. And so what I told my patients, or what I'm telling my patients is, fertility treatment is transient. Your estrogen levels are elevated for a small amount of time. So, it is not a large risk. Certainly, if you can get Pfizer or Moderna, go for it. But if not, I'm perfectly fine with you getting the AstraZeneca vaccine. And that's across the board what all fertility doctors are telling their patients. But if you do feel like you are at higher risk, let's say you have high blood pressure or, I don't know, you have high cholesterol, anything that could predispose you to extra clotting, you've had a clot in the past, a history of a DVT, then certainly talk to your family doctor. And I have heard that some family doctors will sort of push one way or the other if you have other pre-existing conditions.
Okay. And then, so what also comes to my mind, someone, I don't even, I've read so much, I don't even know where it came from. Okay. So there was one recommendation where they're saying, okay, if you're in the middle of an IVF and you're, oh, actually frozen embryo transfer. And so the recommendation was don't do it like a couple of days just before the embryo transfer.
So that's based on the ESHRE guidelines. And actually the CFAS initially put out the same guidelines based on the European guidelines, where we said, and they said, to try not to do the vaccine within 5 to 7 days of an embryo transfer or egg retrieval, again, because of this inflammation and immune response. But since then, when we've sort of looked at, and not just we, but overall, when we've looked at the effects of the vaccine, truthfully, the strongest effect is really the sore arm. And so without these sort of crazy reactions, fevers, and things like that, you're not going to have a problem with your cycle. So, you know, we're advocating, again, please get the vaccine whenever you're eligible. You know, if you're going to have your egg retrieval, you maybe don't want to have a sore arm the same day. So if you can avoid it, it's more just practically speaking. But I don't think there's any ill towards effect on your cycle if you get it in near proximity.
So what, okay, but again, there's fear, right? Because there are some people, and I've seen it with some of my own personal patients and some other people that I know in my life. Like for myself, I didn't really, I had a sore arm for 2.5 days.
Yep.
And then, so if I'm going to self-report now, and then I had fatigue for less than 24 hours, and I had a headache. I don't normally get headaches. Sure. So not a big deal, but there was something. So I obviously knew I did have a shot, but there are some people that actually get fevers and chills, which is also considered a good response. But then there's fears around that. Oh, will a fever make an impact for my fertility in that cycle? Thoughts?
Yeah. Well, I mean, I think, again, we derive from the pregnancy data, and this is something that was cited in many of the guidelines because, you know, pregnant patients were worried, okay, well, let's say I get the vaccine and I believe that it's important and it's safe and I won't get COVID, but then I have a fever, and there's some data that fever increases things like neural tube defects and whatnot. I mean, if you look at pregnancy in general, how many pregnant patients in 9 months have gotten a cold or a fever and had, you know, a mild URI? They take some Tylenol and they're okay. So there's no data that having a fever in pregnancy that's transient and taking Tylenol can cause any problems. Lots of women have headaches in pregnancy and pop a Tylenol too, and it's perfectly safe. So again, I think there's a lot of sensationalism, and you have to look at the data, and the data suggests that there's no increased risk of adverse events to the pregnancy in the first trimester, no increased risk of infertility, second trimester loss, stillbirth. None of these have been proven entities. And, you know, enough pregnant women have gotten vaccinated that we should see this data by this point if there's something that really could happen.
Right. And this is where I say, you know, there's complaints about, gosh, Canada is taking so long. And then like on the flip side, it's like Canada is like a late adapter, and we get to watch all these other countries like the US south of us. They've got like, they have lots of examples, right? So we're looking at the data from them.
Right. And in a way that's nice, right? That we can see that before we're sort of, you know, mass vaccinating.
Yeah, absolutely. All right. So next question. mRNA in of itself, right? Like the Moderna and the Pfizer one specifically. There's fear about it compromising their DNA. Can you like speak to that?
Yeah. I mean, you know, this is not, in some ways it's a novel type of vaccine. Like we all have accepted that this is novel and was rolled out very fast, but it's not a novel vaccine in general. Like this has been used in lots of different treatments. But what is the science behind the mRNA vaccine? So what happens is mRNA is the precursor that tells your body to make a protein. So what happens with this vaccine is that the mRNA is coding a protein that's made by the coronavirus. It's a particular small piece of the coronavirus called the spike protein. So this mRNA is injected into your arm. It goes into cells and it tells the cell to make this protein called the spike protein. And then it's rapidly degraded. It never enters the nucleus, cannot enter the nucleus. So it's gone And then you have this spike protein that mimics the coronavirus that your body sees as foreign, and you create an antibody response. The mRNA does not cross the placenta. It doesn't cross into the nucleus. It doesn't integrate into your DNA. There's no data to support this happening whatsoever. It just encodes a specific protein, the spike protein, that causes an antibody response. So this is a very utilized method.
That's not new.
Cancer treatments, cardiac therapy, it's not new. And again, if we were seeing, some of these things that are being sort of, thought up of, we would have seen this in prior treatments with mRNA vaccine vectors as well, and we have not.
So then there is, someone says, oh, is it worth the risk because there's so many variants of COVID, and, will it even be that effective because there's so many variants now?
Yeah, absolutely. And that's a very fair question, especially when we're seeing that vaccinated patients are still getting COVID. And, the data has shown that most of the variants are covered by the vaccine. Now, listen, viruses are super smart. That's one thing we have learned with virology, that viruses just mutate like crazy. Mm-hmm. And so probably not all the variants are fully covered. But what we've seen is, regardless of the variant, if you are vaccinated, your risk of severe illness from COVID-19 of any variant is going to be incredibly lessened. And so, yes, you might not be 100% protected against the Indian variant or the South African variant, but if you're exposed to that virus and you're vaccinated, you might just suffer symptoms of the common cold. And so that is a big deal when we're seeing patients who are not vaccinated be hit with these variants, and young, healthy patients, especially, being ventilated in the ICU. So just another reason why we need to vaccinate everyone, so that the risk of severe disease is significantly lowered.
Mm-hmm. Now, let me look. If you have, oh wait, sorry. Okay, so that's the variance piece. And then, okay. And here's another one. There's hesitancy, and I don't go out anyway. So really, I don't have much of a risk.
Yeah. So, and again, I hear this question all the time too. I mean, I think it's probably a little difficult to be a complete hermit.
Yes.
Right? I mean, we have all our essential needs, doctor's appointments, grocery, getting milk or bread or eggs. So I think yes, there's a lot of Amazon deliveries and grocery gateway and whatnot. So I guess it is possible to never leave your house, but, you go and get your mail, and, you open the door for someone who's delivering a package, right? And so I don't think that you can mitigate exposure risk completely. And so, you can be in interaction with someone for 15 minutes and be at risk for getting the virus. I mean, this is how viruses spread. Mm-hmm. So, yes, I'm sure there's probably lowered risk for those people who are completely isolated, but you can't remain that way forever. And I think one of the other things we've realized, when we first were exposed to COVID back last March, I think everyone thought this is going to be a 6-month or a 1-year virus. And here we are a year and a half later. And I think COVID is here with us to stay. It's not going to be eradicated. And so, one may say, well, I'm on Zoom every day and not going out, but you can't remain that way forever. At some point, you will be exposed.
Right. So then, okay. And then there's the people who've actually had COVID. Yes. And then they're in a position of saying, well, for some, right? So some actually do choose and say, yes, I want vaccination. But then there are others that say, well, I don't really want to. And I'm fearful of vaccinating because I've heard that, the first vaccine may be okay, but the second one, you have more adverse reactions. So if I've had COVID already, if I get vaccinated, then I'm going to have a severe reaction.
Yeah. So all of those things are probably true. And I'll put in a little personal plug here because I am a physician who had COVID.
Oh my goodness. Okay.
Yes.
Thank you for sharing.
And even as a physician, I was concerned about those things. So I can speak from personal experience and having done tons of research on this, having been personally through it. You know, natural immunity does not last forever. And we've seen this with other infections. And I can, you know, speak about one that's very common, chickenpox and rubella or German measles. So chickenpox, like 99% of the population has had chickenpox, but I can't tell you the number of patients that come into our clinic and we check everyone for chickenpox immunity and they don't have immunity because we're human. Our bodies aren't perfect. So their immunity wanes and they need to get a booster shot. So similarly, if you've had COVID-19, you might be immune for a transient period of time, but that long-standing immunity that comes from vaccination is not there. And so you are still at risk potentially, albeit potentially at lower risk. And so, yes, your immune system's sort of on fire because you've had the virus before. And yes, I can speak personally in saying that the second shot does cause more symptoms.
Okay, wait. So let's backtrack. Let's be very specific.
Absolutely.
Did you get sick or were you asymptomatic when you got COVID?
I had mild symptoms when I had COVID, and I was exposed the day I was vaccinated for the first vaccine. So I think the first vaccine probably reduced my symptomatology, but not by much because I just received the vaccine that day. So I was one of the lucky ones that had only mild symptoms. Okay. But I did receive my second vaccination within like a week or two of being out of isolation. So yes, I had some more symptoms than probably expected with the second vaccine, but nothing unbearable and certainly nothing that wasn't comparable with my peers who didn't have COVID. But again, everyone will feel differently. And, you know, I'm not here to say, oh, everyone will be like me. But I think the biggest thing that I learned from this is you're never 100% protected. And yeah, like, I mean, I joke saying I probably have super immunity now that I've had both vaccinations and had the virus.
Yeah.
But listen, we've got to go back to the data. Like there's lots of reports now of fully vaccinated and even partially vaccinated people who are being hospitalized with COVID. So I think you just have to protect yourself as much as you can. And I think, you know, saying I won't get the shot because of the risk of having a more adverse effect from shot 2 or shot 1 is really nothing compared to the risk of COVID itself if you are one of those people who falls into the moderate or severe category.
So people are watching live, and so I am clear that they're going to be curious, how sick did you get on the second vaccine?
Yeah, absolutely. I had 12 hours of muscle aches. It was like a flu-like syndrome. That's it. I took a Tylenol and I went to bed that night. But I compared notes to, you know, my fellow physicians when they got the second vaccine, and they said, oh yeah, the second vaccine is a bit of a doozy. So it was very similar.
Right. So really it's individually dependent.
It's individual. Right? And I think that, you know, what I learned is, you know, I was just as freaked out as the next person when I actually converted to positive, but most patients are mild, like most people are mild. So all those scary risk factors, you have to take it seriously. You have to get vaccinated, but those are, you know, small numbers. So same thing with getting vaccinated post-COVID infection. I think the majority of patients will have mild, maybe a little bit more severe after the second shot. Like Mary, you've gotten shot 1.
Yeah, shot 1. Yeah.
Yeah. So, you know, I'll have to touch base with you to see how you are after the second shot. But I think most people after the second shot, regardless of COVID-19 infection, feel a little bit crummy for 12 hours. So I'm not, you know, I don't think that's a worry or concern.
Okay, that's really great. So then let's talk about, because we're talking about shot 1 and shot 2. So there's some people, and now we're in Canada and we're in a place of, you know, Pfizer and Moderna, they say do it within 21-day time frame. 21 or 21. And you know, everyone like went, like I saw people's reactions like, what? 4 months out? That's insane. Yeah. So how effective can that be? And it's like, is it actually going to help me? So let's address that.
So again, I mean, there's a reason for the 2 vaccine theory with the majority of the vaccines, and it has to do with the type of immune response you develop. T cell and B cell immunity. And one is sort of like an initial flare reaction with the first vaccine. And the second vaccine gives you prolonged immunity. And so you want both of those, right? So I mean, I can only imagine the theory in Canada, and I'm sure there's some politics behind this, but we won't get into that
We're not
conversation.
into politics right now.
No, but I think, the goodwill behind the getting everyone their first dose is certainly there. And I think the idea was to vaccinate the majority of the population with shot one, at least, to reduce the burden to society, which is, makes sense. And there was also a, supply and demand problem as well. But I think, that first shot is going to give you a certain level of immunity that is protecting most people during this third wave. And so it is very important to get it. And I think following through with the second dose is equally as important to give you that prolonged immunity. In terms of whether the 4-month sort of interval is okay, the product monographs do say you can go beyond the 3 and 4 week interval. And in fact, even for healthcare workers, that interval was prolonged. I can tell you that mine was closer to 5 weeks, I believe, or instead of the 4-week interval. So again, nobody really knows. We're in the first year of COVID, right? So who knows if it's 3 weeks, 4 weeks, 5 weeks, or if you only need one shot. But I think at this point, we have to stick to the guidelines and get everyone their first shot and hopefully get everyone their second shot in a reasonably timely fashion.
So that's interesting that you say that too, because of course there are people that are sitting on the camp of, I just want the one shot and I'm done.
Yeah. I think you are selling yourself short of that prolonged immunity. You probably have some element of immunity, but the way I look at this is, if you talk to the physicians in the ICUs now, locally and otherwise, there are patients that are converting between dose 1 and 2. So there is something to be said about that second shot, or not getting your first shot and waiting for the second shot. People are converting between dose 1 and 2. And I think particularly if you have any comorbidities, the elderly population, if you're immunocompromised in any way, you are at higher risk for contracting the virus. And so the whole why should I get it at all is out the window, and you should get that second shot, and you should still maintain public health measures. So masking, hand washing, social distancing, following the lockdown rules are really important between dose 1 and 2.
Right. Of course, rather than saying, oh, I've got the dose and I'm good.
I'm good to
whatever,
go.
Right?
Exactly.
Yeah, you're right. And there is more of a laissez-faire attitude, I believe, with some of these people that come in after they had a vaccine, I've noticed. Right. So thank you for bringing that up. Now, of course, there's also going to be the query about, I prefer Pfizer and Moderna because they're more studied. Should I bother with the AstraZeneca? And then the whole blood clotting fear, you kind of spoke to it. And then, is one vaccine better than the other for pregnancy or trying to conceive or breastfeeding moms?
Yeah. So, you are correct. Pfizer and Moderna are the most studied, the mRNA vaccines. And, if you want to be data driven, those two do have the most evidence behind them. However, all 4 of the vaccines that are approved, AstraZeneca, J&J, Pfizer, and Moderna, are not live vaccines. So the big deal with pregnancy and people who are trying to conceive and postpartum patients is if you take a live viral vaccine, you're putting your potential fetus at risk, or your eggs that could be a potential fetus. And so because all 4 of these are not live vaccines, any of them is indicated for all the populations we are discussing. But because Pfizer and Moderna were the ones that were most studied in the pregnant population, the recommendation is that if at all possible, pregnant women should receive Pfizer or Moderna. But in the absence of having availability of those 2 vaccines, getting any COVID-19 vaccine, including the AstraZeneca vaccine, is better than no COVID vaccine. So I think the bottom line is risk of COVID is more severe. And so please go ahead and get whatever vaccine is available. If you can get Pfizer or Moderna and you're pregnant, please do so. But in the other populations, it's okay to get any of them. And exactly what I touched upon before, that yes, there have been reported adverse events of blood clots in the AstraZeneca population, but these were far and few between. And like I said, it's like getting struck by lightning. Your risk of a blood clot is very low.
Mm-hmm. Okay. And then, so there's also lots of talk about deferring. Again, I'm not saying that I'm pretending I'm one of them. So
Sure.
I'm not saying that I don't want a shot, but I would feel more comfortable if I'm out of the first trimester, or I would
Yeah.
feel more comfortable if I'm in my third trimester to actually have birthed my baby before I get it. What do you say to
Yeah.
that?
I mean, again, data driven, like look at the New England Journal of Medicine paper, look at all the healthcare workers that have been vaccinated to date. And I mean, I really do focus on this New England Journal paper because it's a large study, a large cohort study, almost 40,000 women. Yeah. And they compared pregnant and non-pregnant patients, and there was just no increase in adverse events. And that included first trimester complications, miscarriage, congenital anomalies, birth defects, preterm labor, or anything that's pregnancy related. In fact,
means that's any part of the
pregnancy. And that's to be directly correlated with the fact that if you are a pregnant patient and you do get COVID-19, there's clearly a documented higher risk of ICU admission, mechanical ventilation, and pregnancy complications that include preeclampsia, needing to deliver the baby early. Because if you think about pregnancy, as the uterus grows, you're pressing upon the lungs. And so ventilating a patient or even ventilating yourself, like being able to breathe, is going to be severely compromised. So there have been numerous pregnant patients that have been delivered early when the fetus is not ready in order to help the mother survive COVID.
Right.
So when you compare that, I mean, you're really harming your baby and harming your pregnancy outcome if you don't get the vaccine and you get COVID.
So that's interesting too, because if you look at actual pregnancy patients, and some of them I've seen even in the first trimester where they're already complaining of, oh my gosh, I get shortness of breath. Correct. I huff and puff going up the stairs, right?
Exactly.
So that can be that risk factor that you're talking about. That's something to address. Yes. And again, you know what? The government of Canada says we advise strongly, but it's not mandatory, but
it's
advise
not mandatory.
Right.
Yes, it's not mandatory. And I mean, all our guidelines say the same thing. It's a risk-benefit discussion with your physician. Ultimately, we all have free will, right? And the patient has a choice. But I think, we've been in COVID now for over a year. And I can tell you that there have been maternal mortalities reported. There have been women who have delivered their baby, have been unbeknownst infected with COVID-19. This happened a lot in New York, my hometown city, where there was quite the surge. And imagine having your baby and then being in the ICU on the vent.
Right.
And all of this is preventable.
Yeah. Because I just saw a documentation. It's a psychologist in the US, and she had a stillbirth baby. Like, she herself was okay, but the baby wasn't. So it's sad. It's hard to get through.
Yeah. And I mean, I think it's interesting because in the future, I really do think the COVID-19 vaccine is going to be like the flu shot. Rarely now, I mean, patients ask about the flu shot, but they're not worried about it getting it in pregnancy. It's like oh, do I get it? Okay, you say to get it, let's get it, right? Like, and I really think this is going to be standard of care. It's going to be the new flu shot in years to come.
Right. Yes. Yeah. And they will be standard care for sure. How much immunity do we get after the first shot?
So within 7 to 10 days, you have 70% immunity. And the numbers vary a little bit. It's like 64% for one of the vaccines, 80%. I mean, they're all within reasonable standard deviations within 10 days of your first shot. But the question is, how long would that immunity last if you didn't get the second shot? And the second shot is like a booster. And so it's what gives you prolonged immunity. But, we are seeing that, in Ontario, just because that's where you and I are, we are seeing a trend downwards of the caseload. And I think that's because patients are getting the first vaccine. So there is something to be said about getting that first dose and, achieving some element of herd immunity, and the caseload going down. So we are seeing the results.
Awesome. So I'm just going ahead looking at other questions. Right. We did talk about antibodies that does transfer through the placenta.
Yeah.
Right?
I mean, again, this is preliminary data, but what we're seeing is there have been some studies looking at cord blood and breast milk. So cord blood is the placental blood. and newborn blood. And there has been evidence of SARS-CoV-19 antibodies in those 3 locations. So that is very reassuring, that vaccinated mothers can pass along antibodies. And this is not so surprising because passive immunity to the newborn through breastfeeding and pregnancy has been documented for numerous things.
Right. So this came to my attention, and I actually emailed you this morning. I thought this was a great question. How is Canada recording vaccine adverse effects for pregnant women and their babies? So this is, if you want to actually do your own research.
Yeah. Actually, I thank you so much for presenting that, because that's an area I feel like I've studied COVID-19 and vaccination like up the wazoo, but this was a new area of interest that I hadn't looked into before. So through Public Health and Health Canada, there is a fairly up-to-date adverse events. And this, I'm going to check my notes while we talk about this, but it's basically Ontario Public Health does it's called AEFIs, adverse events following immunization. And they have an update weekly for the COVID-19 virus. And I did print out everything that was up to date through April 24th, which is like 10 days ago. And so they are quite up to date in terms of reporting adverse events. Like there's a whole document here. And like, for example, it said 305 new AEFI reports were received this week, April 18th to the 24th. So there is a way you can self-report or report if your patient has an adverse event. So I would just call Public Health, and, they are looking at this document. They're being very specific, and these events are recorded, much like in the US. And there's a document that produces all of this. So it is interesting to look at. And this is public record. Like you can Google it on the internet. And I found it very interesting. Like in the period of December 13th to April 24th, they said there were 1,878 AEFI reports after 4 million plus doses of the COVID vaccine. So that ratio is already small.
Right.
But interestingly, out of those 1,878 reports of adverse events, 1,815 were reported as non-serious. So again, that shows you the majority of this small number of adverse events were mild.
Right.
There were only 63 that met serious criteria.
Right. And again, you got to put it into perspective, right? When you say 63, some people go, oh my gosh, that's a lot. But then you compare to the actual
4 million doses that were administered. I mean, again, struck by lightning, the chances of getting struck by lightning. So, to me, that was very reassuring. I mean, if you take an adverse event like thrombocytopenia, I mean, there was a case, I think, of an OBGYN in Florida who got thrombocytopenia and actually died, which is low platelets. And, so everyone was sort of focused on that. And when you look at this adverse event reporting report, there have been 3 reports of vaccine-induced immune thrombotic thrombocytopenia purpura. Again, 3 out of 4,629,000. Like your chances of getting a heart attack or getting hit by a car from leaving your house are probably higher.
Absolutely. So then the question is, and you actually said this right from out of the gate about long-term study, which we don't have. We don't have that kind of data because we're into it, second year, right? Because typically when we look at post-vaccination adverse events, the structuring is over 5 to 10 years. Yes. So you know what,
we'll learn.
We'll learn. So then, but then I could see that person will say, well, then I'll wait 5 years.
Yeah.
Right.
And I mean, and that would not be wrong to say that we don't have long-term data, but I think I'll go back to what I said, that it's been 1.5 years into the pandemic, and we know and understand this virus, and we know about the serious health threats associated with COVID-19. And what's even more interesting, I find now, is the long-term sequelae. Patients who are sort of long haulers from COVID-19 are suffering from prolonged effects. So what I tell patients is exactly that. Like, do you want to put yourself at risk not only for acute serious events like hospitalization and intubation, but if you are like the majority of patients that gets mild or moderate disease, you could still have, compromise that's prolonged. Like patients are reporting neurological effects and prolonged chronic, heart and lung disease, GI disturbances. So these are all serious things that can be prevented by vaccination. And so far the data is reassuring about the vaccine.
Mm-hmm. Well, it's certainly lots to chew on, and so I love to be very honest and authentic, and I loved it that you were authentic about sharing your story of actually contracting COVID. Some people have come in late, but so I'll share with you mine. Like I did get COVID vaccination, but I will say that there was hesitancy, and not because of disbelief or anything like that. It was actually out of my personal experience with, so for example, through fertility treatment, I actually had a hysterosalpingogram, which is like an x-ray, and I'm allergic to iodine. And when I went through, and they signed the forms before I actually did the HSG, I checked off that I was allergic to iodine, right? But when I got to get the testing, they said, okay, we're going to shoot the dye. I said, okay, so does it have iodine in it? And the guy says, well, don't worry, it's okay. We've never had anybody react. And I had to surrender to the system and just trust that I'll be okay, even though I knew that I had allergies. And, well, I had a severe reaction. I was supposed to fly like within 2 days after. I had to cancel my flight. I had to call the doc. The doctor called me and says, you cannot go on a plane because my whole insides were inflamed. Right. And I couldn't walk for like 4 days. It was like a disaster. So, having that experience had me be fearful of like an unknown vaccine
or an allergic response. Actually, right? That's one place where we as physicians have said, if you have a history of allergic reactions, that you should discuss it with your doctor. So I can understand how you would have felt that way.
So I did it, but I didn't have any of that.
Good. Happy to
right.
hear it.
But so the point is like, I get the fears are real for sure.
Absolutely.
Right. And so we need to address them and again, we're not here to say yay or nay. We're certainly here to help you choose what's right for you that will provide the least amount of risk. And because we've been there ourselves and we are women.
And I think knowledge is power, right?
Yeah.
So you want to feel like you understand what you're getting yourself into. So just hearing the data in a digestible way, like you present it, Mary, through these sessions is extremely important.
Yeah. And like the last thing we want you to feel is that you're being pressured to have a vaccine. Like, I don't think that's healthy for anyone, but just go in there kind of like buyer beware, but you don't actually have to pay. Right. So any last thoughts? I just want to see if there's anything else here. Canada's system for AFI doesn't encourage or allow self-reporting like the American version does. How can individuals file a report? You just mentioned it.
Yeah, I mean, it's interesting in this whole report, there's no obvious, link where you would be able to self-report, and it's not as clear. But I think having spoken to public health many times, both as a physician and as a patient, having gone through it, I will say they're incredibly receptive. And so I think if you just called public health, if you want to self-report an adverse event, or even as a physician, that they would very well be able to direct you to the right place. And clearly from this report, the adverse event reporting is quite specific and quite accurate. So there is a pathway.
Thank you. Thank you so much for spending the time. And I knew this was going to be a long conversation. Normally we want to be like, okay, let's try to pack it all in 20 minutes. But there's no way. This topic is way too big. And I don't know. I can actually see. I don't know if there's any response. Okay. So we're good. Like there's no questions here, I don't believe. And if there are, then we may, do another one.
Absolutely.
But we covered so much ground.
COVID-19 vaccine part 2, and I'm sure there'll be more data coming out in the upcoming months. Anything new always has more data. And so I'm happy to rediscuss when we have more information. But
absolutely. Yeah, of course.
This was helpful to your viewers, and patients feel empowered to make a decision that's appropriate for them.
Yeah. So for those of you watching or just jumping on, you can go back to this. I know this is a live event, but it will be obviously put up permanently through this website, through this Facebook group, as well as if you go to my YouTube channel, Meet Mary Wong, or could just go to marywong.life, it'll be there permanently as well. And so we will definitely follow up. I'll take you up on that down the road. And then next week, we actually have an acupuncturist, Whitney Fessler, who is a fellow of the American Board of Oriental Reproductive Medicine, that we're going to talk about. She actually has a fertility story herself, and she's currently, I think she's about 20 weeks pregnant. And so she had the first and second vaccine. So again, it will be great. People love to hear actual anecdotes, right? Personal experience. So, you know, we just want to help you be more rest assured. And she herself sees mostly fertility patients. She said that 80% of the patients that she sees are fertility based. So again, it'll be, you know, more anecdotal reporting through her case studies. So we'll talk about that, and then her actual fertility story. So that'll be next Wednesday at 8:30 p.m. Eastern time. So thanks for being here. And again, on Friday, you can check the City Line interview, 10 a.m. And then next Thursday, there's a book and brunch, which is a supportive community event. There's a host, Susanna Dracul, who actually had a fertility issue. She now has a baby, and she invited me to be the guest speaker. And we're going to talk about my book, Pathways to Pregnancy. So gotta check that out, and we shall see you next week. Thank you so much again, Dr. Sharma, for being here and taking the time out. And I know we both have young kids, and we both had a long day, and yet we showed up. So I really want to honor you.
Oh, and you too. Thank you for being so diligent in educating people about these important issues.
Thank you. Okay, guys.
Okay, take care. Good night, everybody.
Good night, everyone.
Bye.